Let's shift gears and bring you this discussion now. The Gauteng Health Department announcing the opening of the Wits Roy McAlpine Burns Unit at Hani Baragwanath Academic Hospital in Soweto, marking a significant milestone in enhancing the facility's ability to care for burn patients. Over 700 cases admitted annually. They need specialised treatment, and this is more pressing than ever. To discuss the impact that this new facility is likely to have on patient care, let's welcome Professor Adelin Muganza, who's the head of the Burns Unit at Bara and joins us now in studio. And Prof, you and I have had an exercise of patience this morning because you've been here for quite some time, but have been diligently waiting for an opportunity for us to speak about this. Indeed. Welcome to the SABC. Thanks for your time.
Thank you for hosting me.
And it's such an important development, this, because I think in the past there had been a number of concerns about how this facility will respond to demand in many instances. But there are three, I suppose, main institutions that I'd like us to just reconcile. There's the Roy McAlpine Foundation, there's Wits University, and there's also the Gauteng Health Department. What's the relationship between these entities and the burn unit?
Yes, no, thank you very much. You know, the burn unit was established in 1991. Initially, it was the same partnership between the Johnson & Johnson, the Wits, and the government. Now, we had some challenges in the past because we had limited number of beds. So we couldn't admit everyone. Now the Roy McAlpine came in and made that donation of 70 million rand to the Burns Unit. That was already 4 years ago. And of course, it went through our mother house, which is the university. You know, you cannot do this thing without the government. First of all, the government accepted the donation, and the government as well played a major part in terms of buying some equipment, especially funding for staff.
Absolutely. Take us through how far you're hoping this will go. I mean, you've already touched on the constraints that you had as a unit for quite some time. You know, bed issues was a big problem, especially around winter, I understand, yes, where we typically see there's an uptick in the number of patients with burned wounds. How much of a difference will this unit make, do you hope?
Yes. In fact, the project is completed now. So we have a new 12 advanced beds in ICU, intensive care. When we're talking about bed, it's not just a normal bed. It means it's a package. You have a monitor, you have ventilators, and you have other instruments that need to advance burns treatment. But on top of that, we've been having a major problem in terms of operating time. Because, you know, burns, if you delay an operation, then your patient can get infection. And if infection comes with a lot of complications. So this donation allow us to have a new operating theater, which means that we'll be doing more procedure, because a burn patient sometimes need 4 to 5, even more operations if he has a large wound before a total healing of the wound.
Yeah, and we'll speak about the different types of burned wounds, because I do understand there's a distinction between that and how you treat it. Yeah. But the sense I'm getting is that the foundation has donated that 70 million rand, which is great startup capital, I'm sure. But how confident are you that you'll be able to keep the unit running at its standard for the foreseeable future? I mean, because I imagine that also needs a bit of money.
Yes. Yes, of course, the Roy McAlpine gave 70, but we don't forget as well that the university, as an academic institution, put in as well 30 million. And in terms of maintenance and buying other consumables and paying the staff, that's the government. And I'm happy that the government took that responsibility, fulfilling their promises, and by funding even more posts. So we have more doctors, more nurses that we are busy recruiting, because we can't work without nurses in this project. But we had a track record of keeping this unit well maintained, clean for 33 years. As I said, the Burns unit has been running for 33 years. I've been there for 20 years. And if you go there, you still see the cleanness of the unit. So we'll make sure that for our patient, to be well treated, we need to keep the environment clean, and we must have the necessary equipment, instrumentation, and dressings. So,
often when we speak about Chris Hani Baragwanath Hospital, and by we I mean people from the outside who don't know as much as you do, it's lauded in some instances as the largest on the continent, which means there's a huge population that you have to cater to. When it comes to specifically this burn unit, I mean, how far reaching is the net of people you're hoping to catch? Is it just for Joburg-based individuals, or are you anticipating perhaps because of the level of your care to start having to treat patients from maybe even outside of South Africa?
Yes, mainly we treat patients from the Gauteng area, but we do receive patients as well from other provinces. And we do time to time receive patients from far, but very rare that we see patients out of South Africa. Maybe once a year, but of course with the consignment of the management. But it's mainly South Africa. But the part that we doing as a difference is to continue education and training. So we do education and training of the health providers, especially in the burns management in South Africa. Myself, I do travel. Next week I'm going to Mafikeng. We do receive doctors from Limpopo, from Mpumalanga, even from Eastern Cape. They come and do training. I do go to Umtata sometimes, just to teach. So it's not only the treatment, but we want to prevent burns to happen as well. So we are involved into planning of prevention as well.
Right. Yes. That's a great segue to what I'd flagged earlier about understanding the different types of wounds. Because I don't think we spend enough time actually speaking about that. The kind of wound I'd inflict on myself from putting my hand on a burning stove, for example, versus a house going up in flames is very different. Yeah. Are you finding that there is that understanding in society? And perhaps you can just take us through mainly what some of those wounds entail.
Yes. Look, burns is a preventable condition. I think we know, like children less than 4 years, it's more hot water. So sometimes there's a problem of negligence at home. But we know as well that if you improve, let's say, the building laws and the regulations, you will have less burns. But that will take a long time, And we know other causes of burns which are not related to agents that cause burns, like electrical burns, like chemical burns. Electrical burns is on the rise at the moment, and especially around Gauteng here.
Really?
Yes.
What's causing that, Prof?
Yeah, many causes. Of course, we had a lot of cases during the load shedding period. But what I know as well, that when the price of copper at the international market goes up, it looks like there are some syndicate that trying to steal the high voltage cables. Many of those patients, they die on the scene. We don't see them. But those who come to us, actually, they have severe burns. So all these things are preventable, because that's where we have to go, because to treat burns is very expensive. So if we reduce the load, the volume of patients coming to us, then we can save money as well for other disease. But burns itself is very, very expensive. You need a multidisciplinary approach. You need many people to be involved. You need plastic surgeon, nurses, physiotherapists, occupational therapists, social workers, psychologists, even social workers for one patient. So all these things we need to prevent.
Yeah, without a doubt, sure. And we hope that this unit will certainly help us go a long way in doing that.
Yes.
Prof, thank you once again for your time and for coming by to help us understand this. Really do appreciate it. Professor Adelin Muganza is the head of the burns unit at Chris Hani Baragwanath Hospital. They, of course, have just unveiled a state-of-the-art burns unit, we're told, which hopefully will be able to assist in not only educating people about these burns, but also treating those who unfortunately find themselves needing the services. Once again, Prof, thanks for coming through.